This is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about scarlet fever. If you or your child was diagnosed with scarlet fever and are having any of the following, please stop the video and come right back to the emergency department. If you have difficulty breathing, voice changes, hoarseness, or muffled hot potato voice, drooling or difficulty swallowing, worsening sore throat, especially with neck pain or inability to turn the head, inability to take liquids or medication, or if not improving after 2 to 3 days, or feeling sicker at any point. Scarlet fever is a syndrome including a rash and sore throat. It is caused by a particular strain of strep bacteria that makes a toxin or poison. The toxin causes a rash only in some people who are susceptible to the effects. The rash is pink discoloration of the skin, but more important finding is the sandpaper-like feel of the rash. The rash usually starts 12 to 48 hours after the onset of the fever. Abdominal pain or aching in the arms or legs may happen shortly before the rash develops. Scarlet fever is not related to rheumatic fever, a much more serious disease. The only connection between the two is that they are both caused by the bacteria that causes strep throat. Aside from the rash, there is no significant difference between scarlet fever and regular strep throat. Strep pharyngitis is an infection in the back of the throat and tonsils caused by the bacteria called Streptococcus pyogenes. The word pharyngitis means sore throat. Some cases are very obvious, while others require a rapid strep test or a culture to diagnose. Symptoms of strep pharyngitis include fever, sore throat, painful swallowing, headache, abdominal pain, even vomiting. Your child may have swollen tender neck or glands as well. There is usually pus or white spots, patches on the tonsils. Diagnosis and testing. Testing for strep is not always necessary to make the diagnosis. In general, children who have cold symptoms, runny or stuffy nose or a cough, will not have strep throat even when their throats are sore. Testing everyone for strep throat when the infection clearly is viral is not recommended. Some people carry the strep bacteria in their throats all the time without becoming sick. We call those people carriers and will have a positive test even though the bacteria is not causing their symptoms. Center criteria. It is over 85% likely that your child has strep if he or she meets all 4 of the following conditions. Fever, either here or at home. Pus in the back of the throat, swollen lymph nodes below the lower jaw, and absence of cold symptoms like runny, stuffy nose, or cough. Treatment. The treatment of strep pharyngitis includes antibiotics, fever, and pain medications, and drinking plenty of fluids to avoid dehydration. It is very important that your child takes your entire course of antibiotics, even if he or she feels better before the antibiotics are finished. Your child can take children's ibuprofen if he is more than 6 months of age, or acetaminophen as directed on the package. This will help the fever or the pain. It is necessary to make sure no complications have developed and that the infection is healing as expected. Occasionally, resistance to antibiotics will complicate the care and other antibiotics might be needed to be prescribed. For other videos like this one, please go to edxitvideo.com. But remember, these are educational videos only and should not replace the care or attention of your medical health professional.